Would you like to know how to improve your heart health and reduce your risk of cardiac events? We have a famous UK cardiologist joining us today to discuss this. So if you'd like to find out more about that, keep watching. In terms of, obviously, testosterone might be something someone would consider to change their life or treat symptoms, but obviously there's the heart health benefit, as you've explained. What other things could one do to improve heart health? I mean, I've seen one of your really, really interesting videos on blood pressure. Is it just a number? So you guys can check that out and go, on Dr. Gupta's channel. There's some really great videos on there. But yeah, what things would you say? I mean, obviously there might be a lot, but if you think the most important things, what would you say?
Number one, I think when we look at all bad things, there's only four reasons why bad things happen. If you really distill it out, one, because we get older, and we don't even know whether some of that may be testosterone deficiency, but certainly as we age, bad things are more likely to happen, and we can't really do much about aging. Two, genetics. There's undoubtedly a very strong genetic link with what happens to us. Again, we can't do much about genetics. Three, luck. There is this thing called luck. You can just simply be very unlucky and have something. And again, we can't do anything about that. But then fourth is lifestyle. And lifestyle, to my mind, is the thing that we can do something about. And actually, when you look at all the medications and everything else that we have for heart health, there's very little out there that actually stops us becoming broken, apart from lifestyle. The medications are better. The medications we prescribe are better after you're broken. So when you look at, say, statins, and if you're otherwise completely healthy, etc., and you don't have familial hypercholesterolemia, then just giving you a statin or giving you an aspirin really doesn't have a huge benefit in terms of what happens to you. But if you have documented coronary disease, or if you have had a heart attack, then something like a statin has more of a benefit. So the problem is, yes, and that's because a lot of the studies, a lot of the research is done for people who are broken. They take studies on patients who've had a heart attack. They don't necessarily take people at the age of 20 and follow them up for 6 years and say, what can we do to stop you having a heart attack? So to my mind, the best evidence and the best thing to do is lead a good lifestyle. And in terms of lifestyle, I would talk obviously about nutrition, and I think nutrition is hugely important. And the reason is because whilst people think that nutrition is about not eating cake and not eating, lots of fats, the reality is the whole of the food industry, I think, is a corrupt industry. I think the food industry is not interested in our health. The food industry is interested in our taste. I think the meat industry is, very worrying to my mind, because when animals are reared for food, the only purpose of that animal is to be made as fat as quickly, so that it can render the most meat.
Yeah.
And what compromises are made to get him to that stage? And if we are what we eat, does that not translate into some kind of effect on our health? So I have worries about the food industry. I personally think that a plant-based diet is better than a meat-based diet. And certainly some of the studies looking at Mediterranean diets have shown that actually Mediterranean diets are probably better than some of the medications at preventing heart attacks. So that's important. The second thing I think is, of course, exercise is really important. And, we are becoming more sedentary. But there's two sides of lifestyle that no one really talks about. The first is the importance of sleep. And very few people talk about sleep, and we compromise on sleep all the time, and everyone is, and people are, hardly anyone gets good, proper, restorative sleep these days. And if you look at animal experiments, animals can, mice will live, can go much longer without food than they can without sleep. So if you deprive mice of sleep, they die much quicker than if you deprive them of food. And sleep deprivation is one of the worst forms of torture as well. And then stress. and no one really, stresses sort of ubiquitous. It's just we're told, do all these things, but no one really does anything proactive to try and actually minimize our stress levels. And I think that stress is probably the biggest killer in the world. So I think from my perspective, if a person comes to me and says, what can I do? I would say work on those 4 aspects. And the chances are that whilst this is probably going to stop bad things from happening to you, the good news is you will enjoy your life. Your quality of life will improve. You will feel better. And that perhaps is even more important.
Yeah, that's great. That's a great answer. Thank you.
I became a consultant cardiologist 10 years ago. And when I started, I was really enthusiastic, etc. And what I started realizing was that people weren't really getting better. We were getting them out of hospital only for them to turn up a few days later or a few weeks later. And it was the same patients. And at one point, what the really defining moment for me was, which led me down this path, was that one of my friends had a heart attack out of the blue,
Yeah.
And that was no big deal. You would think, oh, it's too close to home or anything like that. Not at all. I mean, I'm a doctor. I deal with this all the time. The interesting thing that happened as a result is that we have a lot of common friends. And all these guys turned up to me and said, look, this happened to him. Can you check me out now to stop me coming to the same kind of fate later on? And so now suddenly I was being asked to try and prevent bad things from happening. And the more I looked, the more I realized that, despite all the science and progress in terms of technology, trying to prevent bad things happening, the only thing that really works is lifestyle. Lifestyle, living life in moderation, etc. Tablets, the benefits are far fewer than is purported. The benefits of taking all these pharmaceutical drugs, small benefits. People plug numbers like relative risk reduction, relative benefit, etc. When you look at absolute numbers, the benefits are very small. So my own feeling was, after that, I said to myself, well, what's the purpose then? Why am I here? What am I trying to do? If I don't think I really make a huge difference to outcome, what am I actually doing? This is and the more I realized, the more I said, well, there is a role for a doctor, and that and the role of a doctor should be to take that patient and treat them like a human being rather than a number, and let them feel that they're being treated by a human being rather than some kind of robot. And as long as you can sit with a patient, engage with them, empathize with them, educate them, and empower them, then I think you're achieving something really valuable, because I think that's what patients want. What patients don't want is for someone just to come and say, okay, take this and go away.
Yeah.
And that's why I started my YouTube channel, because I felt that there was a real need to deliver information like this, information like things like testosterone, like pentoxifylline, and making people aware of this. Because for most people, where do they go? Well, they'll only go to a doctor when something's wrong. When they do go to the doctor these days, you can't even go and see a doctor and get 5 minutes with them. You don't even know who you've seen. Where do people go? Well, who's going to reassure them? Where they're going to get good quality information, particularly because everything you look online, it's very difficult to find good information, good, reliable, honest information, because it's also defensive. There's this, and it could be this, it could be that. You need to go see a doctor. So that's why I started the YouTube channel. I was very surprised that people were interested in what I had to say, and slowly it became something that enriched me. And I enjoy it very much now, and I'm very grateful to all the people who watch and who say nice things to me, because that gives me a lot more than what my day job does.
Yeah, and it is really good. Like, I have to say, coming from a healthcare background myself, trying to and seeing when any healthcare professional, doctors, don't explain something, or just reel off the lingo at their level of understanding with those sort of the words, and don't explain the consequences, or introduce it to a level to somebody that, you know, might be an engineer and hasn't been through any of these, or does something else in their life. And your YouTube videos, you know, my parents watch them. People that I've referenced them to people where it's like, oh, you want to learn about blood pressure and what it means, you know, just go and watch it. And I think that you really are bridging that gap. So I think it's really good. Yeah, really good.
Thank you so much.
I like them as well. I've seen quite a few. So
it's called the York Cardiology, the YouTube channel, and obviously you can just search your name as well. But do you see patients? Is that something that I know you do sort of online advice consults and things like that? But So whereabouts are you based?
So I'm a full-time NHS doctor, and I work at York Hospital at the Department of Cardiology. I also do private work, but I do that once every Thursday at the Nuffield Hospital in York. Mm-hmm. And then other than that, you know, I do the videos, and if someone wants to just ask me information, you know, so I do that, you know, so I don't take on the role of becoming their doctor online. You know, so someone comes in and says, oh, you know, I've received my echo report, and I don't know what it means, and I'm terrified. Can you explain what that means? And so I can do that. Yeah.
Brilliant. Fantastic. Well, thank you so much for joining us. I mean, hopefully we can do another video in future. I mean, there's probably...
Yeah, I'd love to. I'd love to. I've become really interested in testosterone. I'm really looking forward to looking for it more aggressively in my patients. And I'm hoping that as I find more patients, that I will empower them to ask about testosterone and look into it to see whether it works for them. You know, ultimately the patient has to decide, given the dearth of, given this kind of lack of expertise around. But I would love to make people more aware of the importance of testosterone.
That's brilliant. Okay, so thank you, Dr. Gupta, for joining us today. I hope the viewers, you know, found that helpful. If you would like to listen to more information and get more information about this, please subscribe, ring the notification bell, because you'll get notified of more content like this. And thanks for joining us. So we'll see you next time.
Okay, see you next time. Thanks.